Pain specifically on the lower right side of the back is not random, and it is not just a pulled muscle. The fact that it sits on the right side and in the lower region narrows down the cause. Significantly, it is pointing to something specific, whether that is a muscle, a joint, a nerve, or an organ. Each one of those causes requires a completely different approach, and treating the wrong one is why so many people stay stuck in pain for months without improvement. In this video, I am going to walk you through every major cause of lower right back pain, how to identify which one applies to you, and the exact steps to fix it. Why the pain is specifically on the right side. Your spine runs down the center of your body, but everything around it is not symmetrical. Your muscles develop unevenly based on which side of your body you use more, how you sit, how you sleep, and how you move day to day. Your internal organs are also arranged asymmetrically: the right kidney, the appendix, the ascending colon, and the right ovary in. Women are all positioned on the right side of the body. Any of these structures can generate or contribute to lower right back pain. This is why two people with lower right back pain can have completely different causes that require completely different treatments. Causes of lower right side back pain. Number 1. Right-sided muscle strain. This is the most common cause of lower right back pain by far. The right erector spinae and the right quadratus lumborum, the deep muscle running along the right side of the lower spine, can be strained from lifting with a twist, sudden awkward movement, overuse during sport or work, or simply from years of sitting with more weight on the right hip than the left. When these muscles strain or go into spasm, the pain sits firmly on the right side and changes clearly with movement and position, worse when bending, twisting, standing up from a chair, or sitting for extended periods. It is usually most intense the morning after the injury and eases gradually with gentle movement and warmth. The pain is often tender directly to touch over the right lower back muscles, and this tenderness is one of the clearest signs the cause is muscular. Number 2. Right sacroiliac joint dysfunction. The sacroiliac joint connects the base of the spine to the right side of the pelvis. When this joint becomes inflamed, overly stiff, or slightly misaligned from an uneven gait, prolonged sitting, a leg length difference, or repetitive one-sided loading, it creates a deep, aching pain in the lower right back that spreads into the right buttock and sometimes the right groin. A key feature of SI joint pain is that it is distinctly worse after sitting for long periods, and then standing up, when climbing stairs, when standing on the right leg alone, or when rolling over in bed at night. Many people with this problem find a specific point of tenderness just to the right of the base of the spine, right at the dimple area of the lower back, that when pressed, reproduces the familiar deep ache. SI joint dysfunction is one of the most frequently misdiagnosed causes of one-sided lower back pain. Number 3. Right-sided sciatica. The sciatic nerve is the longest nerve in the body when it is compressed on the right side, most commonly by a herniated lumbar disc, a bone spur, or spinal stenosis narrowing the nerve canal on the right. It generates a very distinctive pattern of pain that begins in the lower right back and radiates into the right buttock, the back of the right thigh, the right calf, and sometimes all the way into the foot. The pain often has a burning, shooting, or electric quality rather than a straight aching sensation. Sitting tends to make it significantly worse, particularly long drives, while walking sometimes provides temporary relief. If your lower right back pain travels into the right leg in any way, you are dealing with nerve compression, and the treatment must target the nerve pathway, not just the lower back. Number 4. Right kidney issues. The right kidney sits just beneath the right side of the rib cage, tucked close to the spine. A kidney stone, kidney infection, or kidney inflammation on the right side produces a deep, constant aching in the right flank and lower back that is very frequently mistaken for a muscular problem. The critical distinguishing feature is that kidney pain does not change with posture, movement, or stretching. It is present regardless of how you sit, stand, or lie down. Additional signs that the kidney is involved include a burning sensation or pain during urination, unusually frequent urination, urine that is dark, cloudy, or has a strong odor, nausea, and sometimes fever or chills. If any of these signs accompany your lower right back pain, the kidney needs to be evaluated by a doctor before any self-treatment is applied. Number 5. Appendicitis. The appendix sits in the lower right abdomen, and when it becomes inflamed, it causes pain. That classically starts around the navel and migrates over several hours to the lower right side of the body, where it is often felt as much in the back as in the front. Appendicitis pain is progressive. It gets steadily worse over hours and does not ease with any position or movement. It is accompanied by nausea, loss of appetite, fever, and sometimes vomiting. This is a medical emergency that can become life-threatening if the appendix ruptures. If your lower right back and abdominal pain is worsening steadily with these accompanying symptoms, do not continue watching this video. Go to emergency immediately. Number 6. Right-sided piriformis syndrome. The piriformis is a small, deep muscle that sits in the right buttock directly on top of the sciatic nerve. When it becomes tight, overworked, or inflamed from prolonged sitting, running, or direct compression, it can irritate or compress the sciatic nerve underneath it, creating pain. That feels like it originates in the lower right back and the deep right buttock. The key distinguishing feature from true disc-related sciatica is that pressing firmly into the center of the right buttock muscle clearly reproduces and worsens the pain, whereas true disc sciatica is more reproduced by spinal movements. Piriformis syndrome is also typically worse after prolonged sitting and eases once you stand and walk for several minutes. Number 7. Poor posture and one-sided daily loading. This is one of the most common and most correctable causes of persistent one-sided lower back pain. If you consistently carry your bag on the right shoulder, cross your right leg over your left when sitting, sleep on your right side without knee support, sit with your weight shifted to the right hip, or use your right hand and arm for most physical tasks throughout the day, you are placing uneven, repetitive load on the right side of your lumbar spine every single day. Over weeks and months, the right back muscles tighten and develop trigger points. The right SI joint is overstressed, and persistent right-sided lower back pain develops. No amount of stretching or heat will resolve this permanently unless the daily loading habits driving it are identified and corrected. How to identify your specific cause? Ask yourself the following questions to narrow down the cause. Does the pain change when you move, stretch, or change position? If yes, the cause is muscular, joint, or nerve-related. If the pain stays exactly the same no matter what you do, investigate the kidney. Does the pain travel into the right leg with burning or tingling? If yes, you have nerve compression either from a disc or from piriformis syndrome. Does pressing into the center of the right buttock reproduce the pain? If yes, the piriformis is involved. Is there a specific tender dimple point at the base of the right spine? That points to the SI joint. Did the pain come on in the lower right abdomen first and move to the back with steadily worsening intensity and fever? That is appendicitis and requires emergency care. Exact solutions: how to get rid of it. Fix 1. Right quadratus lumborum stretch. Stand with feet shoulder-width apart. Raise your right arm overhead and lean your entire torso slowly to the left, creating a long stretch along the entire right side of your lower back and flank. Hold for 45 seconds. Do 3 sets on the right side, twice daily. This is the single most targeted stretch for right-sided lower back pain and directly releases the quadratus lumborum, the deep muscle most responsible for one-sided lumbar tightness. Most people with chronic right-sided lower back pain feel significant relief after just a few days of consistent practice with this stretch. Fix 2. Right piriformis and SI joint figure 4 stretch. Lie on your back with knees bent and feet flat on the floor. Place your right ankle on top of your left knee in a figure 4 position. Gently pull your left thigh toward your chest until you feel a deep stretch in the right buttock. Hold for 45 seconds. Do 3 sets. This stretch simultaneously releases the right piriformis muscle and mobilizes the right sacroiliac joint. addressing two of the most common causes of lower right back pain in a single movement. If you feel sciatic tingling in the right leg during this stretch, ease off slightly but stay in the position. The nerve is being gently mobilized. Fix 3. Sciatic nerve floss for right leg symptoms. If your pain travels into the right leg with burning, tingling, or shooting, nerve flossing is essential. Sit upright in a chair, straighten your right leg fully out in front of you while simultaneously tilting your head back and looking upward at the ceiling. Hold for 2 seconds, then bend the right knee back down and drop your chin toward your chest at the same time. Repeat this slow, controlled movement 10 times. Do 2 sets, twice daily. This gently mobilizes the sciatic nerve along its full length on the right side, reduces inflammation around the nerve, sheath, and progressively reduces the leg symptoms over time. Always perform this slowly, and gently aggressive nerve flossing can temporarily worsen symptoms. Fix 4. Heat therapy and targeted self-massage. Apply a heating pad specifically to the right side of your lower back for 15 to 20 minutes. Focus the heat on the right side rather than placing it across the full back. Targeted heat maximizes blood flow and muscle relaxation precisely where it is needed. Follow the heat immediately with the quadratus lumborum stretch while the muscle is warm and more pliable. For deeper trigger point release, place a tennis ball between your right lower back and a wall. Lean into the ball at the point of maximum tenderness and hold steady pressure for 30 to 45 seconds, then slowly roll to the next tender point. This breaks up deep muscle knots that, stretching alone, cannot fully release. Fix 5. Correct your daily loading habits. Identify and systematically correct the habits that are overloading the right side of your spine. Every day, stop crossing your right leg over your left, switch your bag to the left shoulder, or alternate daily. If you sleep on your right side, place a firm pillow between your knees to level the pelvis and take stress off the right SI joint overnight. Check your sitting position right now. Is your weight even across both hips or shifted to the right? Make centered, even seating your new default. These corrections remove the repetitive daily strain that is preventing the right side from healing regardless of how much you stretch or treat it. When to see a doctor? Seek immediate medical care if the pain is severe and progressively worsening over hours. If it is accompanied by fever, nausea, or vomiting, if you have any changes in urination. Alongside the pain, if the pain travels into the right leg with numbness or significant weakness, or if you have any reason to suspect appendicitis. Right-sided pain that does not shift at all, with movement or position, always needs medical assessment before self-treatment is applied. That is everything. Every major cause of lower right side back pain, how to identify which one applies to you, and the exact steps to fix it. If this video helped you, hit the like button and subscribe for more back pain relief content every week. Comment below and tell me whether your pain stays in the right lower back, travels into the right buttock, or goes further into the right leg. I will reply personally and point you to the most relevant fix for your exact situation. I will see you in the next one.